Recording today, we are covering bone markings and the joints of the body. Our goal is to get through all of them. We will see if we do get through all of them during our session today, but that is certainly our goal. So when we are talking about bone markings, ultimately all of the bone markings of the body that we're learning this semester are pretty much focused inside joints. So over on the left of the screen, you can see a list of all of the joints that we needed to learn this semester. Quite a few joints, right? So by the end of our review session here, I'm hoping that we will have hit each of these joints organically. We've hit them where they are in the body. When you're studying bone markings, remember that your lab packets often had spaces for you to organize those bone markings into joints, because that's the big picture. That's what they're there for. But when you're thinking about learning your bone markings, what I told my students in class each week, please don't spend a lot of time going through and completing that activity in your lab packet. Please don't spend 2 hours organizing the bone markings into the joints. What's more important for you and what's more worth your time is for you to actually go through and learn where the bone markings are. Because if I learn where all the bone markings are, and if I learn where the joints are in the body, if I know where these things are, when I get a question on the exam that asks me about joints in the body and what's part or what bone markings are in that joint, if I know those things, I can predict the answer. So as much as we can learn the most important information, that's going to help us predict what we just literally don't have memorized space for. So keep that in mind today. I'm not going to make lists with you of what we find where, but we are going to look at different parts of the skeleton. We're going to label some of the major bone markings in those places to help us make sure we know where the joints are and we know what bone markings are there. So I'm going to start with the arms. We're going to work through the arms, we're going to work through the leg, and then go back up to the vertebrae to the skull. We are looking at a picture of the shoulder joint. So when we look at the shoulder, some of the most important bone markings that you'll find there, what actually makes up the shoulder overall, is this part here that's called the head of the humerus, the head of the humerus. And this portion over here, this green indentation, which is called the glenoid cavity, the glenoid cavity. Knowing that the two bones that come together at this joint are the humerus and the scapula helps us to predict the name of this joint. The name of this joint technically is based on the glenoid cavity, so it's called the Glenohumeral Joint. So the Glenohumeral Joint is the main joint of your shoulder, formed between the head of the humerus and the glenoid cavity that I see on the scapula. Nearby the glenohumeral joint, up above it, we have this one up here. This one up here is called the Acromioclavicular Joint, and there's no way I'm going to write it all, but Acromioclavicular Joint. This is another joint that gets its name from bones and bone markings that are in these locations. So coming from the back side at the end of the spine of the scapula is this marking here called the acromion. The acromion reaches around from the back and it helps us to form the shoulder joint, the acromion. The acromion articulates with, or we've got ligaments that connect it to the clavicle. Remember way back from our first week with bone markings that on the clavicle, all we have to know is what's called the sternal end, which would be by the sternum, and the acromial end, which is right by the acromion. So if I ask you about bone markings that we have at the acromioclavicular joint, well, one of those bone markings is in the name. It's the acromion that's found on the scapula. The other one also has acromio in its name. It's the acromial end of the clavicle. Another bone marking worth noting in this area is my other projection off the scapula that reaches out. This projection is what's called the coracoid process. The coracoid process The coracoid process and the acromion work together for muscle attachment in the shoulder. So this is the smaller of the two bone markings on the scapula that reach forward. The acromion is larger. The acromion is also at the end of the spine. So some differences between those parts of the shoulder. Next to the head of the humerus, a couple other markings that I'll point out. We've got two bumps up here. These two bumps up here are called tubercles. So we have a greater tubercle and a lesser tubercle, and their names are not a trick. It's not tricky. The greater tubercle is the bigger of the two. The lesser tubercle is the smaller of the two. So my greater is here lateral. My lesser is here more medial. There is an indentation in between them. If you remember from your origin insertion activities, this is actually one of the places where we see some of our muscles inserting on there. That's a place called the intertubercular sulcus. So it's an indentation between the tubercles. The only other bone marking that I'll mention on this view up here by the shoulder, you can kind of see a little bit of a bump here on the humerus. This bump is called the deltoid tuberosity. And like its name suggests, the deltoid tuberosity is where the deltoid muscle would attach to the humerus. So our bone markings really serve just two purposes. Purpose number one, making up joints like we just saw. And purpose number two, a place for muscles to attach to each other. So we've seen a lot of the major bone markings of the shoulder either for attaching muscles or making those shoulder joints. If we go down into the arm, we can again see some of those markings that we had on the humerus before. So remember that the two bumps were the tubercles. So I've got the greater tubercle and the lesser tubercle. We can also see the region that was inside the shoulder joint, the head. We can more clearly see on this view that deltoid tuberosity that's down here for the deltoid muscle to attach to. Then we get down into the ends of the humerus. And we have some specific bone markings to know on the humerus that form specific joints. So at the elbow, you actually have three bones coming together, and we can see them labeled on our picture here. We have the humerus coming from the top, and then we have the radius and the ulna coming from the bottom. If you remember from the group work activity from this week, we ask you to identify, I believe it was the humeral radial joint, or it was the humeral ulnar. I can't remember for sure. Regardless, those joints are right next door to each other. So this region right here is what we call the humero radial joint, where the humerus articulates with the radius. And over here on this side is my humero ulnar joint. These joints both work together to form the elbow for you. Oops. All right, so we've got the humero radial joint and the humero ulnar joint. When we talk about the humero ulnar joint, this is going to be the bone markings that are specifically on the ulna and the humerus at this location. The ulna, let me briefly bump to the back side to show you. Remember that the ulna has this C-shaped thing that reaches up to grab the humerus. This is why we can't do what's called hyperextension of our forearm. We can only go back so far before the bones block us, because there's a little C-shaped bone, it looks like this, little C-shaped thing that sticks up, and that thing, we can see it best on here, is the thing called the Olecranon, or the Olecranon process. So the Olecranon is where the ulna reaches up to articulate with the humerus. On the back side, we have the Olecranon, but on the front side, to make sure that the ulna and the humerus stay attached to each other, we also have something called the coronoid process. The coronoid process. So if the ulna at the top is shaped like a letter C, the C part that sticks out at the bottom is the coronoid process. And the C part at the top that sticks out is called the Olecranon. The coronoid process of the ulna is going to articulate with a part of my humerus that I see right here. This part of my humerus that's just for the coronoid process, this is called the trochlea. The trochlea. And the goal of the trochlea is to provide a smooth surface for the coronoid process to rub against. So we have the trochlea that's medial because the ulna is medial. On the outside, where the radius is going to articulate, this is where we find the bone marking called the capitulum. So the capitulum exists for the radius to articulate with the humerus. The trochlea exists for the ulna to articulate with the humerus. When we look at the backside of the arm, the backside of the humerus in particular, notice that we've got this indentation right here. This indentation that we're seeing right here is called the Olecranon Fossa. It's the indentation, remember fossa means indentation. The Olecranon Fossa is the indentation for the top part of that C, the olecranon, to articulate with the humerus. So we can see that indentation right there, and we can also see the flat part where the ulna is articulating with the humerus, and that's the flat part called the trochlea. The trochlea.
No, I'm sorry.
In addition to having the trochlea, having the capitulum, and these other bone markings that we've seen, we also have these two bumps that are on either side of the humerus. We can see them on the front and we can see them on the back. When you are trying to figure out whether you're looking at what's called the medial epicondyle or the lateral epicondyle, your big reference point is always going to be the head of the humerus. The head of the humerus is always medial. So the side that has the head of the humerus is where we would find the medial epicondyle, and the opposite side of the head of the humerus is where we find the lateral epicondyle. So we're looking at the back side of the humerus right now because we can see that indentation, the Olecranon Fossa. Let's go back to the front side. Those bone markings stay the same. So we're still looking for the head. Here's the head of the humerus, which makes this the medial epicondyle, And over here on the side, not very apparent because the capitulum's kind of blocking it, there's that lateral epicondyle as well. So keep track in your mind, lateral versus medial. It has to do with where I see the head. The head side of the humerus is the medial side. The opposite side of the head is the lateral one. At the elbow joint, we've got these bone markings we just talked about. So we've got our lateral epicondyle, there's the medial epicondyle. We talked about the olecranon and the coronoid. One thing we didn't talk about is this structure here on the radius. This top part here on the radius, where it's articulating with the capitulum, this is called the head of the radius. And the radius really doesn't have very many bone markings on it. The head is a major bone marking on it. We also have down at the bottom, we have the styloid process. And you can actually feel this in your own wrist. If you bend your hand backwards and you feel below the wrist joint on the bones themselves, you can feel your styloid process of the radius on the thumb side and the styloid process of the ulna on the pinky side. Your wrist has two styloid processes. Later, we're going to talk about what your ankles have. Those are things called a malleolus. But at both the wrist and at the ankle, we have these parts that point down for muscle attachment that are going to help us at those joints, at the wrist joint and at the ankle joint. The only other marking that I want to mention for you on the radius is the bump that we see right here. Oh, lost my pointer. I was about to just start scribbling everywhere. That would have been fun. Okay. The last thing for us to mention here, that is, I apologize, I'm blanking. I want to call it tuberosity, but I don't want to get it wrong. Bear with me. Even Dr. Ollis needs to study. I'm just saying. Yeah, that is the radial tuberosity. So the radial tuberosity is the bump that we have on the radius. The radius just has the head that makes up the elbow joint, the radial tuberosity that helps it articulate with the ulna, and the styloid process at the end. Then we get down into the wrist joint. When we're talking about the wrist joint, we are talking about the carpal bones. So all of these bones here in the wrist are called carpals. The hands then have bones called metacarpals. And at the very bottom, we have the bones called the phalanges. So I have a slide that's specifically just for the hands. We're going to take some good time on the hands. But what I want to do before I move into the hands is pause to give you a chance to type me any questions in the chat, or if you wanted to turn on your mic and ask a question, that is fine. If you don't have any questions, try to send me a thumbs up or send me a I'm good, so I know that we're tracking.
You said the carpal is the wrist, the metacarpal is what, and the phalangeal is obviously the fingers?
Yes, yeah, so the metacarpals, oh, there it is. The metacarpals are these ones right here. These are the metacarpals. The way I like to remember the metacarpals is they meet the carpals. So the carpals are here in the wrist, the metacarpals are touching them, and then all the bones in the fingers are the phalanges.
And the metacarpals are like the knuckles, or they're still?
Yeah, great question. So the metacarpals are basically the palm of your hand.
Palm, okay.
Yeah, you'd find those in the palm of your hand, and then once we get into the fingers, that's when we start having the phalanges.
Okay, thank you.
Yeah, great question. I got 2 thumbs up. Any other last minute questions?
I have a question.
Yeah, go for it.
So I wanted to know what's the difference between, or how do you know how to identify like what a epicondyle is and just the condyle?
Yeah, so that's a great question. Some of it's going to come down to which joint we're on. The only joint that we actually have condyles that we're asking you to learn on is the femur. So when we're at the knee joint, the flat surface that the femur uses to articulate with the tibia is called a condyle. When we talk about how the humerus articulates with the radius and the ulna, instead of calling those condyles, we're calling them the capitulum or the trochlea. So on the humerus, we do not have a lateral condyle or a medial condyle. We just have the epicondyles. On the femur, we have both the condyles, which are down lower, it's the flat surfaces, and the epicondyles that are the bump up above it. Does that clarify, or can you ask your question a different way if I missed it? Got it. Awesome. All right. Well, let me transition into the hands. The one other thing I'll mention before we move on to the hands, some of the joints, we have already covered the shoulder. We covered the elbow. I do want to mention that we've got here what's called the proximal radio-ulnar joint. Remember that proximal means closer to the attachment site. So here's my proximal radio-ulnar joint because it's between the radius and the ulna. And then down here at the bottom is where I have that distal radio-ulnar joint. So they touch each other in 2 different places. When we look in person inside people at these two bones, they actually have a flat membrane in between them, but they only touch each other at those two places called the proximal radial ulnar joint and the distal radial ulnar joint. All right, so let's go to the hands. When you are learning the hands, you can do a Google search they're called mnemonics, where it's a phrase that you can use to help you know the names of the bones in order. This is the mnemonic that I like to use. Feel free to look up something else or use this one. This phrase, Sally left the party to take Cindy home. This tells me the first letter of every bone that I have in the hand, or every carpal bone. I should rephrase that. The carpal bones each have their own name. We'll come back to the metacarpals and the phalanges. They're easier. They don't have special names. They're more predictable. So let's talk about this phrase and naming the bones. Whenever we are looking at bones of the hand, we're always going to start on the thumb side. So here, let's do metacarpals real fast. All we have to know with metacarpals is their number. So metacarpal number 1 is the thumb. Metacarpal number 2, pointer finger, middle finger, ring finger, and your pinky. So metacarpals number 1 through 5, we always start with the thumb. And remember, we had that clarifying question. These are the bones that make up the palm of your hand. The phalanges out here are the ones that actually make up your fingers. So all you have to know for metacarpal names, 1 through 5. With the phalanges, the numbering system still applies. So these phalanges out here are still number 1s. But remember with the phalanges that we have to use the words proximal, middle, and distal. So my proximal phalanges are the ones that are closest to the metacarpals. I've got this row down here at the bottom. These are my proximal phalanges. I'm going to switch colors here to do my middle phalanges. This is my middle phalanges. Now notice I purposefully stopped. We do not have a middle phalanx on the thumb. The thumb only has 2. So the thumb has a distal phalanx and a proximal phalanx. Everybody else has proximal, middle, and distal, but the thumb only has proximal and distal. So if I'm trying to name, this bone, for example, I would first use these words over here. If it's proximal, middle, or distal, well, this is one of my middle ones. So I'd say this is middle phalanx, and then I use my number. Middle phalanx, number 4. Or this is distal phalanx, number 2. Proximal phalanx, number 1. With the phalanges, learn the naming system. Don't memorize their name. If you can count and if you can predict proximal, middle, or distal, that is all you need to study on those. You don't need to belabor them and memorize them. When we talk about your knuckle joints, so the things that you can crack, what you're cracking are the little fluid-filled spaces right here. In between are phalanges. So your knuckles are called the interphalangeal joints, in between the phalanges of your finger. Same deal actually with your toes. Those also have interphalangeal joints. Where the phalanges meet the metacarpals, we have what's called the metacarpophalangeal joint. Literally, it's a combination of the two kinds of bones. So where the metacarpals meet the phalanges at the knuckles that are attached to your palm, that's the metacarpophalangeal joint. All of these ones out here are interphalangeal joints. The metacarpals interact with the wrist bones, the carpal bones down here. These are called the carpometacarpal joint. Dr. Ellis needs more coffee. Carpometacarpal. Anyone want to send me a little coffee emoji? Carpometacarpal joint, between the carpal bones and the metacarpal bones. Then we get into the joints that we see in between these carpal bones in here. And all of these are called intercarpal joints. So intercarpal joints are in between the carpals. The metacarpal joint between a carpal bone and a metacarpal bone. Thank you, Paula. Paula sent me coffee. I love it. Then we've got our metacarpal bone with our phalange. So it's the metacarpophalangeal joint. And then we have our interphalangeal joint between the phalanges. I'm pointing out these joint names because you didn't have to memorize any of the joint names. If I know the bones, I can predict the names of the joints because it's just based on those bones. So keep that in mind. We've named these joints just based on the bones that come together in those places. That brings us back to the carpals. The carpals are not our friend because they each have their own name. So this is ones that we do have to memorize. So we started our numbering system on the thumb side with number 1. When we are naming the carpal bones, we also start on the thumb side. Let me see. Here we go. Okay, I'll make it clear so we can do this. Okay, so we start on the thumb side. Thumb side number 1. My first bone is Sally, or the scaphoid. Then we have the lunate, number 2, left. The third bone is the word the, so it's triquetrum. And this bone right here is actually on top of the triquetrum. It's called the pissiform. This is another bone that you can feel on yourself. So if you bend your wrist all the way back and feel on your pinky side, where now we're on the hands, we're not feeling the styloid process, there's a little bone bump that sticks out. That bone bump that sticks out is the pissiform bone. The pissiform bone is not visible on the back side of the hand. So when we go over here, notice how over here it says it's the posterior view. We will not see the pissiform bone on this view. So the pissiform is only visible when we look at the front of your hand because it's literally on top of the triquetrum. Okay, so far we've done Sally left the party, scaphoid, lunate, triquetrum, pissiform. Now we go back up to the thumb side to take Cindy home. The first 2 are T's in this row, trapezium and trapezoid. To be totally honest with you, the only way I keep them straight is that the trapezium is first in alphabetical order and the trapezoid is second. So trapezium, trapezoid, capitate, hamate. When we're learning those carpal bones, use your sentence or find a new sentence to talk your way through them. I tell my students to feel their general location on your hand, even if you don't feel them in exactly the right place. Feeling them somewhere generally is helpful for you. So we just named all the bones on the front. If we go to the back side, we still start with the thumb. So we still start with the scaphoid, Sally, left, lunate, the triquetrum, but remember there's no party on the back side. No party on the back, right? Like that hairstyle, no mullet going on. Sally left the, no party. Then we go back over here to take Cindy home. So we always start on the thumb side. We always start with the row that's closest to the radius and the ulna and work our way across. Questions about the hand, bones, joints, otherwise? Or give me a thumbs up. I got at least one thumbs up. Okay, awesome. Well, again, if you think of more questions, we should have some time to review at the end. So feel free to hold on to those questions and we can absolutely come back to those at the end as well. So we've talked from the shoulder down to the hands. Now we're going to go back and we're going to work our way from the hips down. When we talk about the hip bones, this was our very first week of bones and bone markings, so it's been a minute. At the very top of our hips, we have the bone called the ilium. So I like to remember that the ilium is what you put your hands on when you put your hands on your hips. In particular, you're putting your hands on the thing called the iliac crest. So the iliac crest is what your hands go when they're on your hips. The ischium is the bone that you sit on. So the ischium projects out to the back. In particular, you sit on a thing called the ischial tuberosity. That's the bone marking we sit on. And then here in the front of the hips, we have the pubis bone. So the pubis bone, like the pubic symphysis, which is the joint that joins the two halves together, the pubis bone in the front. When we're looking at the hips, we already mentioned a few of the bone markings. So that iliac crest along the top. We've got the ischial tuberosity, which again is what you sit on, the ischial tuberosity. I'll mention that there's this space, this hole. This hole is called the Obturator Foramen. And now that we've talked about the spinal nerves, that name should ring a bell. The Obturator Foramen is where the obturator nerve goes down into the legs. So the Obturator Foramen, they're in the middle of the ischium bone. Another really important bone marking that's actually on the ilium, the ischium, and the pubis is this deep indentation right here. The deep indentation right here is what we call the acetabulum. The acetabulum. And the acetabulum is the same kind of thing that the glenoid cavity was. So it's an indentation in these hip bones where the head of the femur will fit inside of. It's a lot deeper than the glenoid cavity is. So this acetabulum is that indentation where we see the femur articulating with the hip bone. Okay, so I don't have any other pictures of the hips, so I'll make a point of mentioning that this up here that articulates with the acetabulum, that is the head of the femur, just like we had the head of the humerus. The femur has this long extension right here where the head sticks out. So fittingly, this long extension is called the neck of the femur. Then we've got our two markings here on the side. These two big markings, they project better to the back. So I didn't include a back view for us. But when we're looking at those two bone markings sticking out to the back, those are called the greater and lesser trochanters. So a trochanter is another word for something that sticks out. The greater one is the bigger one that's up high. The lesser one is the smaller one that's down low. Okay, so let's move down then. We're going to go down into the knee joint. Let's go down to the knee. When we look at the knee joint, primarily that joint is made out of the femur coming from the top and the tibia. Those are the two bones that articulate directly at that joint. But I'll also mention that we see the patella as well, the kneecap right here. So when we're looking at the knee itself, we have what's called the femoropatellar joint. That's right here between the femur and the patella. And we have the tibiofemoral joint that I see right here. We also, while we're at it, have what's called the superior tibiofibular joint. So another one that's found up there by the knee. Here's my little fibula down here, little fibula. So the question that we had earlier was asking us about condyles and epicondyles. This is a good view to show us that the condyle is this part down here at the bottom. So the condyle is right here where we actually articulate with the tibia. The epicondyle is the part that sticks out up above it. So here's that epicondyle, and here is the condyle down below it. When we look at the knee joint, if you can't see the head of the femur, let's go back. My head of the femur is on the medial side. So there's that head of the femur up there. That's going to make this the medial epicondyle, and that's going to make this the lateral epicondyle. I use the head of the femur as a reference point. If I don't have the head of the femur, like in this picture here where there's no head to be seen, what I can see is the fibula. And we need to know that the fibula is on the lateral side of the leg. So if I'm looking at the one that's on the side of the fibula, that's going to be my lateral epicondyle. And if I'm looking at the one that's on the opposite side of the fibula, that's going to be the medial epicondyle. The tibia is the bone that's medial. The fibula is the bone that is lateral. On the front of the tibia, you can see this bump right here. This bump that we see is called the tibial tuberosity. This is really important for attachment of things like the rectus femoris muscle. So tibial tuberosity is that bump that we see sticking out there. We also see, okay, we can kind of, apologies. We can kind of see up here when I'm looking at the tibia by itself, how I have this flat surface for articulation with the femur. These are the tibial condyles. So the condyles that we have, the lateral and medial condyle on the tibia, we have those up here at the top to articulate with the condyles that we have on the femur. Lots of condyles found in the knee joint. When we go down to the ankle joint, I'll start by mentioning that the bone that the tibia directly articulates with, and the fibula as well, to make the ankle joint is a bone called the talus. The talus. And that's important because when we're looking at the names of the joints down here, we have one called the talotibial joint, where the talus articulates with the tibia. So the talotibial joint is right here, where the tibia is articulating with the talus. We also have the superior tibiofibular joint, superior tibiofibular joint, tib-fib. And we've got the inferior one down lower as well. On both the tibia and the fibula, the parts that you feel when you touch the two sides of your ankle, these are those bone markings called a malleolus. Malleolus. So a malleolus is what makes up the two sides of your ankle. The tibia, which is medial, is going to have the medial malleolus. The fibula, which is lateral, is going to have the lateral malleolus. So they each only have one malleolus. That's the bones that you feel on either side of your ankle. So the lateral and the medial malleolus are found at the ankle joint. Things like the tibial condyles, those are going to be found closer to the knee joint, which remember was the tibiofemoral joint. The only markings we need to know on the fibula are the head up here at the top, and then that lateral malleolus down at the bottom. So we also like the fibula. The fibula doesn't have too many bone markings for us. I'll label on my my side view of the foot here, we'll label some of the tarsal bones, but then I'll go to those just by themselves. In this view, we can also see the large heel bone that's called calcaneus. So the calcaneus is the bone in the back of your foot. The one that makes up the ankle, like we talked about, is the talus. We also have a bone that we can see over here that's called the navicular. And then we get into some that are harder to see. We're missing one of our cuneiform bones all the way over there. And the last one we can see over here is one called the cuboid. So I'm going to flip here in just a moment. I'm going to flip to the pictures like you have in the lab packet for labeling. But want to mention while we're looking at the side view of the ankle, just the way things fit together. The talus is the bone that the tibia and the fibula are directly interacting with at your ankle. Just an alternate view of the same thing. Here is, we can see the talus bone right here. Here's the talus. and we can see the calcaneus sticking out behind it. So here's the fibula, if we're looking down on it, and there's the tibia. So just another view of the foot that I thought was cool because Dr. Ollis is a nerd. All right, let's talk about the feet. Again, you can do a Google search if you don't like my phrase and find another phrase. But when we are naming the bones of the feet, the phrase that I like to use is tiger cubs need and then milk, spelled with a C. So just like we did with the hands, when we're naming these tarsal bones in the feet, we start on the big toe side. So we start with T, talus, tiger, C, cubs, calcaneus. We go back up here to my next row. I've got one bone here. That's N, navicular, need. And then we count our way across. M, I, L, C. This is the medial cuneiform, intermediate cuneiform, lateral cuneiform, and the cuboid on the side. Tiger cubs need milk is the way that I like to review it. When I'm looking at the foot from the side, we already talked about this a little bit. So the bone that sticks up that makes the ankle joint, that's the talus. The calcaneus is your heel bone. We can come back over here to navicular. In your lab packet, the picture that you have, you can actually see there's that medial cuneiform. Then we've got the intermediate, the lateral, and the cuboid. Tiger cubs need milk. When we're naming the bones of the feet, it's exactly the same naming system as we used in the hands. So the big toe is number 1. We count our way over. These bones that you find making up the sole of your foot, these are called the metatarsal bones. As a group, these back here are all the tarsals. So when we're talking about the places where the talus bumps into the navicular, that's an intertarsal joint. When we talk about the place where the tarsals bump into the metatarsals, that's these guys, metatarsals, that's a tarso-metatarsal joint. Then we go out here to the phalanges. So this joint that I'm highlighting now is my metatarsophalangeal joint, where we go out to meet the toe bones. Just like in the hand, the big toe only has a proximal and a distal phalanx. So my proximal phalanges, that's this first row. My distal phalanges is this outermost row. And then I've got middle phalanges on everybody except the big toe. Keep losing my pointer. There we go. Middle. Oh, not on him though. Ignore that. That was an error. Middle phalanges on everybody except number 1. So proximal, middle, and distal. Phalanx number 3. Phalanx number 2. Proximal, middle, distal. Phalanx number 5. We always called the other ones metatarsals, and we just give their number, and then all of those tarsal bones have a name. Let me pause for a moment, give you a chance to ask any questions that you have or any markings we want clarity on. Yeah, or you can give me another thumbs up. I do love me some thumbs up. I'm gonna pull out the penguin again because it makes me happy. All right, well, we have hit the arms. We have hit the legs. Now I want to go back up in the body, and I want to go to the skull and talk about some of the bone markings of the skull, talk about the way that the skull articulates with the vertebrae, maybe pull in some pictures of different types of vertebrae for us to compare those to each other. So when we look at the skull, the names of the bones of the skull, a lot of them are based on regional terms. So way back in week 2, in the beginning of the class, we learned about things like the frontal region or the temporal region or the occipital region. Those names came from the bones that are found in the area. So that's a good review for us. I always told my students when we were working through these bone markings, remember the words that we did in week 6, right before the final exam. Because we had words like foramen. Every time you see a bone marking that has the word foramen in it, it's always a hole. So I've got what's called the supraorbital foramen. It's the hole above the eye. I've got the infraorbital foramen, the hole below the eye. I've got the mental foramen, the hole that's in the chin, the mental region. So every time I see foramen, it always means a hole. When I talk about things that are called a margin, we have a couple of things that are called margins, like the alveolar margin. That's on the edge. So that's the edge of where your bones meet your teeth. In the maxilla, which is this top bone here, the maxilla, as well as in the mandible, which is the bone that we see down here. When we look at the side view of the skull, we can see a couple of really important processes. A process is always something that sticks out. So we've got this really big process right here. This really big process right here is called the mastoid process. The mastoid process. That should hopefully sound familiar because of the sternocleidomastoid muscle that attaches there. We also have the styloid process, this little one that sticks down. Both of those are bone markings that we find on the temporal bone. We also have this open space right here, something from lab actually this week, called the external acoustic meatus. This is where sound waves go when you are perceiving them. So the external acoustic meatus, along with the mastoid process and styloid process, lots of markings that we see there on the temporal bone. One that can be a little bit tricky is the stuff that makes up your cheekbone. So when we talk about the parts of your cheekbone, half of your cheekbone comes from the temporal bone. So here's the part of your cheekbone that's coming from the temporal bone, right here. The other half of your cheekbone actually comes from the zygomatic bone in the front. When I talk about naming the various parts of your cheekbone, the part right here that's on the temporal bone, but attached to the zygomatic bone, I call this part the zygomatic process of the temporal bone. The bone marking tells me who this bone is attaching to. So it's the zygomatic process of the temporal bone. And so on the zygomatic bone, we have the temporal process of the zygomatic bone. When you're trying to keep those bone markings straight, just my hint for you would be, who is it attaching to? Whoever it's attaching to is where the bone marking name comes from. We got to know the names of the bones. If I know who they're attached to, that's gonna help me out with the name of that marking. I'll also mention, just to make sure that we cover it, the place where the bones of the skull attach to each other are called sutures. So we have various sutures throughout the skull. The one that we have on the top is called the coronal suture. Corona means a crown. So the coronal suture is where a crown would sit on the head. We also have the squamous suture, and I'm blanking on the name of my other, bear with me. Lambdoid suture. Okay. Squamous suture over here on the side, the squamous suture, squiggly line on the side, and the lambdoid suture in the back, lambdoid. Before I flip to another view, are there any other things you want me to point out on these views of the skull? Any other markings that we want to clarify? Okay. Well, let's go to the inside view of the skull. When I look at the inside view of the skull, one of the most important markers to make sure that we know, oh, I lost my pointer. There we go, is this big hole right here. This big hole is foramen magnum, and I can see that on the outside. I can see that on the inside. This is where the spinal cord leaves the brain. When we're on the inside, we also want to make sure that we know this indentation right here. This indentation is called the sella turcica, and it's where the pituitary gland that's coming down from the brain rests inside of. So it's a nice little indentation or a divot there. We have a couple of holes right here for cranial nerve number 2, the optic nerve. So these are the optic canals. And up toward the front of the skull, you can see these small little holes. These small little holes are called the cribriform foramina. Cribriform foramina. These are little holes for cranial nerve number 1, the olfactory nerve, to send down nerves so you can do the process of smell in your nose. When we look at the bottom view, I just want to point out a couple of bone markings. One of them that I want to point out are these indentations right here. These indentations right here are called the mandibular fossa. Mandibular fossa. And one of the joints we're learning this semester is the Temporomandibular Joint, where the mandible articulates with the temporal bone. Here's my indentation for where that happens. The other bone marking I want to point out, because it's important for joints for us, is this thing right here. This is a raised thing. This is called the Occipital Condyles. The Occipital Condyles. These are bumps that are actually going to articulate right on top of the vertebrae, right on top of C1, which is called the atlas vertebra. So those bumps that we just saw, I've got them highlighted here in red. Here's those occipital condyle. The occipital condyles sit right on top of what is called the superior articular facet. Superior articular facet of the atlas. The atlas is our first cervical vertebra. It's the one at the very top. You will recognize this one because it has those superior articular facets. So this is the place where the skull rests on top of the vertebral column. When I look below C1, when I look below the atlas, which we just talked about, underneath that is a bone called the axis. The way you're going to recognize the axis is because of this part that sticks up. This is called the dens. So the dens is the part of the axis that sticks up. The dens is what allows you to rotate your head back and forth. So the atlas sits right on top of, here's the atlas sitting on top of the axis, and the atlas can rotate back and forth around the dens. This is how you rotate your head back and forth. I don't think, yeah, so I did not pull other vertebrae pictures, but let me point a couple of things out that are important about vertebrae. We know when we're looking at these vertebrae that we are looking at cervical vertebrae because they have these things right here called the transverse foramen. Transverse foramen. These are holes for blood vessels that are on the outside of our cervical vertebrae. So these are blood vessels that go up to the brain, the transverse foramen place for blood vessels. Every single one of our vertebrae have this large hole in the middle, and the large hole in the middle is called the vertebral foramen. The vertebral foramen. And everybody no matter which kind of vertebrae you are, thoracic, lumbar, or cervical. Everyone has to have this big hole because this big hole is what allows the spinal cord to be inside the spinal column. Let me see if I have a picture I can pull up fast just to show you. Let's see if it'll let me do this. Okay, perfect. I am showing you the lab packet. So let me just mention briefly here at the end, we just talked about these transverse foramen that are here on the outside of a cervical vertebra. We've also got that vertebral foramen that's in the middle. When I go down to my thoracic vertebrae, these ones I always tell my students are the giraffe vertebrae. So from the side, there's spinous process, which is what you feel when you feel your vertebrae, is a spinous process. Sticks down more, it's pretty sharp and skinny. When we compare that to a lumbar vertebra, the lumbar vertebrae look more like moose. So they have a shorter spinous process that's a little bit wider. Other characteristics, all of my vertebrae have this vertebral foramen in the middle. When we compare the size of the body of a thoracic vertebra to the size of the body of a lumbar vertebra, the lumbar vertebra have a much bigger body because all of the weight of your body is resting on these bones. So the intervertebral joints are in between the vertebrae of your spine, and it's the bodies that stack on top of each other, giving you that joint, giving you your height of the vertebral column. So let me bring us back. Since we're about out of time, let me just mention, here's the picture we started with. I'm pretty sure that we talked about almost every one of these joints. We named almost all of them. As we were going through and talking about bone markings and bone names, those are the tip-offs for these joints. Very few of my joints have a name that you can't figure out. If you know the names of the bones or the bone markings there, for pretty much all of these, you can make that prediction. My one that's the least fair in that regard is this one right here. It's called the coxal joint. But hey, the coxal region was the hip region. So if we can memorize where the coxal joint is, you can pretty much predict where all of these other joints are just based on their name. That's all I've got. I would love to open the floor for questions, either typed or spoken, that you have about bones or bone markings or joints. Any questions that we have left over? Yeah, I got to thank you in the chat. Of course, you're welcome. Happy to help. Well, I'm going to go ahead and end the recording. I will stick around if you have any last-minute questions. But good luck with your studying. I will mention too that there are specific review assignments based just on bone markings. Use those review assignments to help you know which bones you don't know well enough yet. Remember, you can do the assignments as many times as you like. So take advantage of that. Keep doing those assignments until you get your 100, but more importantly, until you are to a point where you feel like you know this stuff and you don't have to keep checking your notes to find the answers. So take advantage of that. Good luck with your studying. I hope to see many of you back at 10 o'clock on Thursday.